Sexually transmitted diseases, STD, are venereal diseases, VD, or reproductive tract infections are called sexually transmitted diseases. Normally, sexually transmitted infections are transmitted from person to person during intimate sexual contact with an infected partner. Infections like hepatitis B and HIV are transmitted sexually as well as by sharing of infusion needles, surgical instruments, etc. with infected people, blood infusion are from infected mother to baby. People in age of 15 to 24 years are prone to these infections. Bacteria, STI, are gonorrhea, syphilis, chlamydiasis, and lymphogranula venereum. The viral STI are genital herpes, genital warts, hepatitis B, and AIDS. Trichomoniasis is a protozoan STI and candidiasis is a fungal STI. STI is caused by bacteria, fungi, and protozoa or parasites can be treated with antibiotics or medicines, whereas STI caused by virus cannot be treated with this, but the symptoms can be controlled by antiviral medications. Latex condoms usage generally greatly reduces the risk but does not completely eliminate the risk of transmission of sexually transmitted infections. Prevention of STDs: avoid sex with unknown partner, multiple partners, use condoms. In case of doubt, consult a doctor for diagnosis and get complete treatment. TNHSB Tamil Nadu Health Systems Project, a unit of the Health and Family Welfare Department of the Government of Tamil Nadu, does free screening for cervical and breast cancer. According to World Health Organization (WHO) 2017, more than 1 billion people globally acquire a sexually transmitted infection every day. India is the third largest HIV epidemic in the world, with 2.1 million people living with HIV. Bacterial STIs, sexually transmitted infection. Gonorrhea, Neisseria gonorrhoeae affects the urethra, rectum, and throat, and females, the cervix also get affected. Pain and pus discharge in the genital tract and burning sensation during urination. Syphilis, Treponema pallidum, formation of painless ulcer on the external genitalia, skin lesions, rashes, swollen joints, and fever and hair loss. Appearance of chronic ulcers. Chlamydiasis, Chlamydia trachomatis. Trachoma affects the cells of the columnar epithelium in the urogenital tract, respiratory tract, and conjunctiva. Lymphogranula venereum, Chlamydia trachomatis, cutaneous or musculogenital, mucosal genital damage, urethritis, and endocervicitis, locally harmful ulcerations, and genital elephantiasis. Viral STI, genital herpes, herpes simplex virus, source in and around vulva, vagina, urethra in female, or source around the penis in male. Genital warts, human papillovirus, HPV, hard outgrowths are on the external genitalia, cervix, and perianal region. Hepatitis B virus, HBV, fatigue, jaundice, fever, rashes, and stomach pain. Liver cirrhosis and liver failure occur in the later stage. AIDS, human immunodeficiency virus, HIV, enlarged lymph nodes, prolonged fever, prolonged diarrhea, weight reduction, night sweating. Candidiasis, Candida albicans, attacks mouth, throat, intestinal tract, and vagina. Vaginal itching or soreness, abnormal vaginal discharge, and pain during urination. Trichomoniasis, Trichomonas vaginitis, protozoan STI. Cervical cancer is caused by a sexually transmitted virus called human papillovirus. Human papilloma virus may cause abnormal growth or cervical dysplasia. The most common symptoms and signs of cervical cancer are pelvic pain, increased vaginal discharge, and abnormal vaginal bleeding. The risk factors of cervical cancer include having multiple sexual partners, prolonged use of contraceptive pills. Cervical cancer can be diagnosed by a Papanicoleo smear, PAP smear combined with an HPV test, X-ray, CT scan, MRI, and PET scan may also cause due to determine the stage of cancer. The treatment options for cervical cancer include radiation therapy, surgery, and chemotherapy. Modern screening techniques can detect precancerous changes in the cervix. Therefore, screening is recommended for women above 30 years once a year. Cervical cancer can be prevented with vaccination. Primary prevention begins with HPV vaccination of girls aged 9 to 13 years. Modification in lifestyle can prevent cervical cancer. Healthy diet, avoiding tobacco usage, preventing early marriages, practicing monogamy, and regular exercise minimize the risk of cervical cancer. Vitamin E is known as anti-sterility vitamin. It helps in the normal functioning of reproductive structures. Sex hormones were described by Adolf Buchanan. 11th July is observed as World Population Day. 1st December is observed as World AIDS Day. A National AIDS Control Organization (NACO) was established in 1992. Syphilis and gonorrhea are commonly called as international diseases.